Hello, I'm from Virgin Care Dermatology. Today I would like to talk about emollients. This video is aimed at all patients who have been prescribed emollients, and it is hoped that today we'll be able to give you information on how to use these effectively. Emollients have been used for centuries. Records show that wool fat was used by the ancient Greeks as early as 700 BC. Thankfully, we have better emollients these days rather than using raw wool fat. Emollients are used to treat the clinical signs of dryness, such as scaliness and roughness. They help to soothe the skin and reduce the feelings of itching and tightness. They should also be cosmetically acceptable to the individual using them. Soap substitutes should always be used. Soaps and shower gels can dry out the skin and can undo the good work that applying an emollient can make. Emollients generally fall into three categories: lotions, creams and ointments. Lotions are water-based and cosmetically acceptable. However, they do not provide enough moisturising to soothe dry skin. Creams are also cosmetically acceptable, but these do provide sufficient moisture for dry skin. However, these do contain additives to prevent the cream from separating. These additives can cause irritation to some people. Each cream has a different amount of additives, so it is better for you to try different types of creams to see which one suits you best. Ointments are thick and sticky. These are usually made from paraffin or vegetable oils. Although your skin may need this level of moisture, they are not always the most cosmetically acceptable. But we do have some tricks to help you. Always apply the emollients to all of your skin, not just the itchy part. Ensure that you use sufficient emollient and that you apply at least twice daily. Emollients are steroid sparing. This means that if your skin is in good condition, you will not need to use your topical steroids as much as you have done in the past. Never rub emollients into the skin. This can irritate the skin and push cream into the hair follicles. Always apply the emollient in a downward direction in line with the hair. If your skin is itchy, try keeping your emollient in the fridge. This keeps it cool and it helps to soothe the itch when it's applied. It may be necessary to use a cream during the day and an ointment at night. If you find the ointments too greasy, you can always mix a small amount, about the size of an almond, with some warm water. This changes it into a soft cream. You can use this as a soap substitute. After washing, pat the skin dry and use a small amount of ointment mixed with water again as a moisturiser. This type of ointment can also be mixed with boiling water in a mug and added to your bath water. Having your bath or shower too hot can aggravate your skin, and it is advisable not to stay in for longer than 10 minutes. Please be advised that washing with water only can dry your skin. It is always best to use a soap substitute. If you have any queries about this video and the information provided, please contact Virgin Care Dermatology Service.